Nursing 474, Child and Adolescent Health. The weekly learning objectives include use evidence-based practices to support care of families within the community, explain potential barriers to community health initiatives and how to resolve them, choose interventions appropriate to an identified community health problem, select technologies to inform, communicate, and enhance health knowledge, and prepare an evaluation plan for the community health wellness plan. Poverty status. 1 out of every 5 children lives below the poverty level in the United States. Children who live in poverty are less likely to be healthy than those who do not. Minority children are overrepresented in the statistics. The infant mortality rate for minority infants is twice that of white infants. 60% of children born to immigrant parents live in low-income families compared with 37% of native-born parents. Characteristics that put children at risk for living in low-income families are parents without a high school degree, lack of parental employment, living in a single-parent household. Low-income status negatively affects a child's ability to learn and succeed in school and exposes the child to a higher incidence of behavioral, social, and emotional problems. Promotion of access to high-quality health services is one of the focuses of Healthy People 2020. For children living in poverty, access to regular and accessible sources of health care is challenging, typically because of the lack of health insurance. Under the Affordable Care Act, the anticipated coverage of all children should improve health care outcomes and preventative services for this vulnerable population. Promotion of healthy pregnancies is also a focus of Healthy People 2020. Although infant death rates in the United States has decreased over the past decades, the United States has a higher infant mortality rate than 44 other nations, and its position in a global ranking has consistently fallen over the past years. Infant mortality rates associated with maternal health, socioeconomic circumstances, quality of and access to medical care, and community health practice are critical indicators of a country's overall health. In this population, risk behaviors are any behaviors that place early and middle adolescents at risk for physical, emotional, or psychological harm. Although some progress has been made in reducing the number of teens who smoke tobacco, used marijuana, and rode in a car driven by someone who drank alcohol, studies demonstrate that this population engages in risk-taking behaviors associated with increased sexual activity, unprotected sex, and alcohol use. Growth is a measurable aspect of this individual's size and follows a predictable pace that is evaluated at regular intervals to determine if a child is growing based on standard parameters. Development involves the observable changes in an individual and relates to physical, psychological, and cognitive achievements. Growth and development is the ongoing process of growth and development resulting in physical, cognitive, and emotional changes. Well-child assessments are scheduled on a regular, ongoing basis to monitor these processes and provide anticipatory guidance to families. Developmental screening. Developmental screening is a process designed to identify children who should receive more intensive assessment or diagnosis of potential developmental delays in any of the developmental domains of gross motor, fine motor, language, or social skills that promotes early detection of delays and improves child health and well-being for identified children. Children with delayed skills or other disabilities may qualify for special services that provide individualized education programs in public schools that are free of charge to families. The Individuals with Disabilities Education Act promotes a collaborative focus on meeting the needs of children with disabilities through the use of individualized education plans, otherwise known as IEPs. Immunizations. Increasing immunization coverage for children remains a significant focus of Healthy People 2020. For children 19 to 30 months of age, the polio and hepatitis B vaccination rates are high, but not for the complete series of hepatitis A. For adolescents, vaccination rates continue to rise steadily, but remain low overall for this group. Several barriers to successful immunization include vaccine costs, vaccine refusal by parents, vaccine shortages, and changes in vaccine schedule and recommendation. The goal of immunization is to protect by using immunizing agents to stimulate antibody formation. Immunization recommendations are made by the American Academy of Pediatrics and the U.S. Public Health Services Advisory Committee on Immunization Practices. Recommendations are designed to provide flexibility to ensure that the largest number of children will be immunized. All healthcare providers are urged to assess immunization status at every encounter with children to update immunizations whenever possible. The National Childhood Vaccine Injury Act requires providers to counsel parents and clients about the risks, benefits, and possible side effects of the immunization. Informed consent is recommended. Vaccine information statements produced by the CDC explain both the benefits and risks of vaccine. Federal law requires that a VIS, or vaccine information statement, be given to the parents or legal guardians before each and every vaccine dose. The Vaccine Adverse Event Reporting System is a national safety surveillance program that requires providers and vaccine manufacturers to report adverse effects following the administration of routinely recommended vaccinations and has been effective in tracking and identifying adverse events associated with vaccines. The built environment. A built environment is simply defined as the person's human-made or modified surroundings in which he or she lives, works, and partakes in recreation. A child's built environment is influential in managing of risk factors for obesity, amount and type of physical activity, risk for injury, and exposure to environmental toxins. Obesity among the youth of the nation has reached epidemic proportions. The CDC defines overweight as a body mass index at or greater than the 85th percentile and lower than the 95th percentile. And obesity is defined as a BMI at or greater than the 95th percentile for children of the same age and gender when plotted on CDC growth charts. Built food environments. Emerging research on the relationship of built environments and obesity evaluates the factors within the individual's environment that may contribute on a macro level or micro level to the development of obesity and focuses on the role of the built environment in increasing energy consumption while decreasing energy expenditure. The Let's Move national campaign is a comprehensive and coordinated initiative to prevent childhood obesity, emphasizing 4 components: healthy schools, access to affordable and healthy food, raising children's physical activity levels, and empowering families to make healthy choices. Nutritional assessment. Physical growth serves as an excellent measure of adequacy of a diet. A 24-hour recall by a parent is a helpful screening tool in conjunction with addressing any parental concerns regarding diet, exercise, and behavioral patterns. Physical activity levels contribute significantly to the overall health of children, and fewer children are meeting the recommended physical activity levels today. Several contributing factors include physically built environment, changes in school practices for physical education, and increased time spent in monitor viewing. Americans have become more sedentary. Schools. Children and adolescents spend much of each workday in school. Therefore, schools have a vital ability to influence student health through quality physical education, integrated classroom physical activity, unstructured play, extracurricular activities, and personal fitness guidance. Media. Children and adolescents spend more time engaged with media, with television, movies, internet, video, computer games, and cell phones than any other activity except for sleeping, approximately 7 hours a day. Research strongly correlates increased use of media with increased sedentary lifestyle, obesity, hypercholesterolemia, and hypertension. An unrecognized public health problem and focus of Healthy People 2020 is unintentional injury, such as any injury sustained by accident, like a fall, drowning, or motor vehicle accident, and is the leading cause of morbidity and mortality in the United States. Injuries and accidents are the single most important cause of disease, disability, and death among children. Motor vehicle accidents are the leading cause of death. Drownings and burns account for most of the other deaths, with poisonings and falls contributing heavily. For infants, the leading cause of death is suffocation. Injury prevention. Healthcare provider offices, schools, community centers, public health centers, and day and preschool facilities provide opportunities to teach children, adolescents, and their families about prevention of injuries. Nursing role in the prevention of accidents and injuries includes identification of risk factors, anticipatory guidance, environmental modification, and safety education. In 2007, 3,067 children and adolescents died from firearm-related injury, and a survey of adolescents reported that 5.2% had carried a gun on at least one day during the previous month. Also, promoting safe playground and recreation areas. Schools, daycare centers, families, and community groups often need guidance toward developing safe places for children to play. The most frequent injuries are fractures, internal injuries, concussions, dislocations, and amputations. Problems of childhood, acute illnesses. Acute illnesses are those illnesses with an abrupt onset that are usually of short duration. For children, it is common for viruses to spread easily through daycares, preschools, and school system. Chronic health conditions are improved medical technology has increased the number of children surviving with chronic health problems, such as Down syndrome, spina bifida, cerebral palsy, asthma, diabetes, congenital heart disease, cancer, hemophilia, bronchopulmonary dysplasia, and AIDS. Environmental health. The built environment that children live in directly affects their health and growth, size, and behaviors place them at greater risk. Lead poisoning is one of the most common environmental health hazards. Environmental tobacco smoke. Environmental tobacco smoke is exhaled smoke from burning tobacco, or smoke from a mouthpiece or a filter end of a cigarette, cigar, or pipe. Cigarettes and environmental tobacco smoke were classified as Class A known human carcinogens in 1992 by the EPA. Children exposed to secondhand smoke experience increased episodes of ear and upper respiratory tract infection. Children of smokers are more likely to smoke. Models for delivery of healthcare delivery to children and adolescents. First is family-centered medical home. A family-centered medical home is a partnership between a child or adolescent, the child or adolescent's family, and the pediatric team who oversees the child or adolescent's health and well-being within a community-based system that provides uninterrupted care to promote optimal health outcomes, incorporating preventative, acute, and chronic care from birth through transition to adulthood. The medical home is not a specific building, but a system of care. Motivational interview. Motivational interviewing is a focused communication strategy in which the parents are encouraged to set goals, identify personal barriers, and identify potential mechanisms to overcome the barriers to make safety and health promotion changes for their child. A collaborative approach to behavior change instead of a prescriptive approach. Interactive health communication is defined as the use of electronic device or communication technology to access or transmit health information or provide health-related support to any consumer or health care professional. The purpose of interactive health communication for families is to provide general or individualized pediatric information and promote healthy choices and safety. The nurses provide care to children and their families in a variety of settings. The nursing process and the knowledge base of the factors unique to this population provide a framework for care. Nursing, through developing and coordinating community service and formation of public policies, promotes the well-being of children within the community. The nursing plan of care includes management of actual and potential health problems, education and anticipatory guidance, and case management and coordination of care.